most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about what is causing you knee pain. Is it bursitis? And we're going to tell you how to tell. So there's a lot of bursitis that can be happening on the knee.
Right.
Suprapatellar, prepatellar, infrapatellar, and pes anserinus. Bursitis.
Before we go any further, Bob, I think we got to just make sure our viewers are familiar with it, because a lot of these terms are kind of like, what the hell is he talking about?
We'll go into it.
Okay, so, yeah. It's much, it's not near as scary as the term sounds,
right,
particularly bursitis. You know, what is it? We're going to tell you exactly what it is. It's not a big deal, really.
Yeah, knee bursitis is also known as housemaid's knee, because if you're doing a lot of kneeling, or clergyman's knee, if you're doing a lot of kneeling. Actually, I knew a therapist when I first started my first job at Mayo Clinic. We were working on rehab, and you work on mats, and we're constantly kneeling on them and working with the patients. And he developed prepatellar bursitis.
Okay.
And it was a big bump right on his kneecap. That's what he had there. So the bursa is a fluid-filled sac. It's a little sac of fluid. It helps act as a cushion, or it reduces friction between like two body parts, like bone and skin, bone and ligament, or bone and tendon.
Right. And I think in these cases, it's oftentimes between the bone and the ligament or tendon. So if my fist is the bone and this is a tendon, it's sliding back and forth over that bone, and it's a way to keep that sliding
kind of
lubricated, things don't wear out. And if that bursa gets inflamed, it's a lot of nerve endings there. It becomes irritated, swollen, and it's a painful thing.
And that's where the itis comes from.
Right.
Bursitis.
Yep.
So we're going to talk. I actually sacrificed my knee here, Brad. So we're going to show you. Okay, so going to show you some of the different types. Okay, suprapatellar. Supra means above.
Above the knee.
Yeah. Patella means kneecap.
Yep.
So very easy. You just suprapatellar bursa, and it's very easy to diagnose this, to be honest, because there's going to be swelling here, you know, and it's going to be tender. You can push right on the area, and it hurts. This one is prepatellar, meaning in front, I guess, right?
Well, it's actually on the kneecap.
Yeah.
I don't agree with that. I think they should call it anterior, but whatever.
Yeah.
It's on the kneecap. It's the same thing. It's swollen. It may be red. When you push on it and rub around, it's going, ow! It's not
again, that was the one that my fellow therapist had, and it was quite a bump there.
Was it a really soft swelling, or was it kind of?
It was soft. If it's been there a long time, it might start to get hardened on you. So you're gonna watch that. And then there's infra. Infra means below the kneecap. So infrapatellar.
So that's kind of almost in the tibia, right? Or just before the tibia?
The tibia tuberosity.
Yeah.
Yeah.
Right there.
And then over here, this is called the pes anserinus. So they go, where does that one come from?
Yeah, where does that come from?
Goose's foot.
Your goose. This is usually Latin terms, correct? And then,
so there's three muscles that come together and attach right here.
Yep.
And that's like is that a goose's foot? 3? I don't know.
That's like the goose tail on. Yeah, that makes sense. And there's the webbing in there. It's all coming together. How they come up with these names.
If those muscles are tight on you, quite often they can cause irritation there and cause a little pes anserinus bursitis.
Again, same thing. Push on it. Palpate. It's going to be tender, sore, a little swelling, possibly red.
So swelling, red, warmth. You might have some stiffness there. And of course, increased pain with kneeling would be another sign.
Right.
So what are the causes again to this? It could be trauma, direct blow to the knee, prolonged pressure to the knee. So, carpet layers, tile layers, wrestlers. As a wrestler, did you get it, Brad?
Yeah, no, I didn't, but I had some other knee issues. But I wore knee cushions, of course, which can be very helpful.
Right.
After I injured my knee, of course.
Yeah.
I waited.
That's usually what you do. A little more serious would be an infection or autoimmune condition, and that's where you got to get the doctor involved and make sure that
The big thing is you're going to avoid things that irritate it.
Right.
Right. Which can be challenging if it's your livelihood or your work.
Right. And you can also see this in athletes.
Sure.
Long distance runners sometimes, or they call it also jumper's knee, like a high jumper or a long jumper.
Repetitive motion, or where you get a lot of really high force.
High force, yeah. So pretty easy to diagnose. You know, if you've been performing some activity like that, repetitive activity, or you've fallen on the kneecap and there's a swelling there, you're gonna probably have bursitis.
Right.
And we can show you some things to do for it in another video.
Oh, that's it. We're not going to talk about the treatment.
Nope, not today.
So along with this, keeping that in mind, this is a part of a series.
Yes, this is a part of a series of videos on knee pain. So if you want to check out the whole series and find out the answer to how to treat this,
very easily,
go to bobandbrad.com and go to the program section and look for the one on knee pain.
Right.
And under that, you will find one on how to treat bursitis.
Right.
And what else, Brad?
Yeah, just look at the title you're looking for. There will be about 30 videos on knee. All together, easy to find the one you want. Just look at the title, click on it, watch the video. There will be a PDF button by it. You can click that and print out a preview and all the exercises or treatment recommendations on that PDF. It's completely free. There's nothing, we ask nothing from you, not even an email, so take advantage of it. It's a really good
Our
deal.
gift to you.
There you go.
All right.
Be careful with your knees.